Clerk will call the roll.
Glenn Whitley, County Judge.
Here.
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Jeff Allen, Commissioner Precinct 2.
Here.
Gary Fickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4. Constitutes a quorum.
Identification today will be delivered by Senior Pastor Dr. Chris Hayes from the First United Methodist Church of Arlington. After the invocation, please remain standing for our pledges. Thank you so much for coming out.
Thank you, Judge. Let us pray. Gracious and loving God, we give you thanks for the beauty of this day and for the opportunity you create for us to live in community with one another. We acknowledge, O God, that there are many in our community that are suffering and hurting this day, and we pray that not only would your presence of love and grace be made known to them, but that we might find ways to be your hands and feet of love to the community around us. Give us your wisdom and never simply our own for all that we do today and in the days to come. For we give you the thanks and praise. In Christ's holy and precious name we pray. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Thank you, Reverend.
Your Honor, could you recognize me, please?
I will in just a minute. Folks in the audience, please, the masks up over the nose. Thank you. Do you want to be recognized before? No, go ahead.
It's your meeting. Good morning.
Good morning.
I want to ask that we adjourn court today in memory of Father Esteban Hasso, the moral conscience of Tarrant County, long-term priest here in Tarrant County, and I fondly call him the patron saint of Tarrant County. He is being funeralized today. In addition, I ask that we adjourn court in memory of the 500,000 Americans who have lost their lives to the COVID pandemic. And I'm going to leave that right there.
Commissioner, I certainly will close in those two. I would also like to close today in memory of Tiffany Jarrett, the district clerk's office, who passed away in a tragic accident last week, or week before last.
Yes.
And we all have her in our prayers and her family in our prayers. Her mom also works for the county and district clerk's office, and so we want to keep them in our prayers also. Mr. Manius, agenda announcements.
Thank you, Your Honor. Members of the court, we have several announcements on the agenda today. First of all, we're going to once again take some items out of order. We're going, as soon as we finish, or as soon as we get to the administrator's office, we're going to then go to the briefing items, and we're going to ask Mr. Tenasia to come up and make his presentation. Also, members of the court, you're going to find that in your packet today, you have a number of additional information. We have on one of our section items on our section, which is item number 4, we're going to be talking about the winter storm that we just went through. And we're going to have a very brief presentation as to where we are as it relates to facilities. There may be other questions that the court may have that we'll try to answer at that time. Also, because we were limited in the various offices that were on site and working last week, you're going to find that our presentations as it relates to the coronavirus is going to be somewhat limited today. We'll play catch up with that. We do have some information for you. We are going to have just a very short briefing when it comes to our particular item. And then finally, members of the court, you also noticed on the administrator section that we have various renewals of declarations of disasters. There's actually 2 of them, and also to do some receiving and filing of orders that the judge has executed. So we'll walk you through each one of those as we get to that particular point. Thank you, Your Honor.
Thank you. Court members, you have before you the minutes of our regular meeting of February the 9th.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson? I think he said yes. For some reason, we're not hearing you. You might try turning the volume up on your computer because you show to be unmuted.
Okay. So what we will do, I think our IT people are down in the back room. We'll ask that we reach out to Commissioner Johnson, see if we can activate his voice.
And in the meantime, if we can get his picture back up there, then what we'll ask him to do is to basically thumbs up or thumbs down. It's the thumb. It's the thumb.
That's the number one thing.
Okay, motion passes unanimously. Commissioner Fickus.
Yes, we have a congratulatory resolution to Mike Hutchison with the Hilton Hotel in South Lake, and we're going to present that in a couple of weeks. It got postponed from last week. So I'll move approval of that congratulatory resolution.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson? Motion passes unanimously.
I do have 2 announcements now.
Other announcements? Commissioner Allen?
Yes, I do have 2 announcements. Before I share those, I did just obviously want to acknowledge this storm that we are through some parts of it, but we know that there are so many in our community who are still suffering the effects of the winter storm from last week. To say that it was traumatic is an understatement. I know that some people never lost power or water, never had any pipes burst, never had to care for perhaps the medically fragile in their family or in their community, and others did. And so kind of that experience, there's a spectrum of that experience. So I don't want to miss the moment to acknowledge that there are folks who are suffering still very deeply, just as the pastor shared in his invocation. And I hope that to whatever degree that my office can continue to be a resource, that you all will contact us. We definitely heard from folks last week. I am very interested in hearing more about the update and what it means for us as a county, as an organization. But then there's still so much work to do to get some real answers. This is not something that our community, that our county, our state should ever have to go through again. And so there's no point in pointing fingers to place blame if that doesn't lead us to resolutions. So I hope that as we move forward in the coming weeks and getting more answers, and obviously I know that a lot of that lies at the state level, but that we as a board and as a county will be sure to strongly advocate for our over 2.1 million residents who pretty much every one of them were affected in some way or another. I also want to say that even though the work of our county has to continue, the business must continue. That's really important, but just not to forget that you're a person, and to know that if you're still like putting pieces of your life back together, but you've got to show up every day for the people of the county. I appreciate you for doing that. I am doing that. Each of us in some way or another perhaps are doing that as well. So just practice self-care, be compassionate with yourselves, with your colleagues, with others, and then, you know, we're Texans, we're tough, so we got through it and we will continue to get through it, but you know, it wasn't easy. So and so 2 announcements is tomorrow evening from 6 to 7 we will be hosting our COVID-19 town hall to receive some very timely updates from Vinny Tenacia. Obviously last week we had to suspend many aspects of our COVID response, which a lot of that has resumed. We'll hear more from Vinny later. But also joining us is Fire Chief Don Carlson with the City of Arlington, who's going to give us an update on the FEMA vaccination site at AT&T Stadium. And then, again, so that's tomorrow evening, 6 to 7 p.m. You do not have to be on Facebook in order to view it on Facebook. So you don't have to have a Facebook account or a Facebook page. Second, on Thursday, February 25th, from 2 to 4 at Asia Times Square, in partnership with the City of Grand Prairie, Asia Times Square, and our office will be hosting a COVID-19 vaccine sign-up. So that's 2625 Pioneer Parkway, room 820 there in Grand Prairie off of Pioneer. And we will have volunteers available to assist with sign-up who speak Spanish, Vietnamese, and English. Again, that's Thursday, 2 to 4 p.m. at Asia Times Square. Thank you. That's all I have.
Well, I too want to take an opportunity to thank so many in the county who did so much over the past week. This was as many people said, it was a 100-year storm that we had, and people were working 24/7. The road crews were out, the folks in the law enforcement area, facilities folks, everybody was doing everything they could to help individuals and to help people through this process. And I can't tell you how much I appreciate the sacrifices that I know were made by so many to be sure that that county services, that essential services were continued. We had power out in many of our buildings. We had pipes break in some of our buildings, and our facilities folks were there helping to repair and to do whatever they needed to do in an effort to get things back up and working or to minimize the damages and the losses that we had. So I too want to thank everyone, and please, department heads, elected officials, please tell your staff how much we appreciate the work that they did and the way they got out and did everything they could to help minimize this, this past week of weather, I guess is the way I describe it. Court members, you have before you the consent agenda.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson? Motion passes unanimously. Mr. Manius.
phoned in. Thank you, Your Honor. Members of the court, we're now going to go to the briefing agenda, and we're going to ask Mr. Chinasia to come up and make his report.
Good morning, Your Honor, and members of the court.
Benny, good morning.
We're back after 2 weeks, so there's a little bit of a catch-up on what's happened with COVID-19. So this morning, we have 239,000 cases in Tarrant County. We're certainly on a decline because the numbers are declining, on a daily basis. 2,794 deaths in Tarrant County. As you can see on the right-hand side, the chart for the Trauma Service Area E, we're starting to see some green colors in different counties. And Tarrant County has gone from red to a sort of an orangish color. So things are on the improvement. Hospitalizations are declining. That downtrend is continuing. We have roughly about 700 people in the hospital. That's 13.58% of our hospital capacity. 159 people in the ICU. That's almost 35% of the ICU capacity. And 28 ICU beds available. But despite all of this, I wanted to point out something, that we're just now getting back to the levels that we saw at the peak in July. So despite all this good news, it's all relative, right? We're thinking we're coming down pretty hard from a big peak, so that's great news. We're heading in the right direction. But we need to be still doing our part, because we're just now approaching the peak of what we saw in July, and we thought that was pretty bad in July. So we still need to continue to do all the things that we're supposed to be doing, like wearing a mask, washing our hands, staying 6 feet away from others, and following all the other public health guidelines. Trauma Service Area E, which is our 19-county region, has been now below 15% for more than a week. So all the effects of GA31 and GA32, the governor's orders, are rolled back. I think restaurants are at a better capacity, I believe 75%.
75%.
Yes, sir. And a lot of the restrictions on elective surgeries and so forth are lifted up for the hospitals as well. And they were automatically triggered as these levels are crossed and stay below a certain percentage, 15% mark for 7 days. So in that area, we're at 11.12%, about 1,791 people in the hospital with COVID-19, and 142 ICU beds remain available. But yesterday marked a grim milestone in our pandemic. We, as a country, crossed 500,000 deaths. And I wanted people to just kind of take a minute and realize what has happened in a span of a year. 500,000 Americans have lost their lives. And there were many people that have come to this podium and have talked about, well, deaths aren't happening, so this is just a made-up pandemic. This is not. This is real. 500,000 of our brothers and sisters have lost lives to this preventable outbreak. We need to really take that seriously and do our part. Again, I want to reiterate, we have tools at our disposal. Social distancing works. Staying away from large gatherings that are not absolutely needed, it works. Wearing a mask works. All of these things we have to do together, along with getting vaccinated, now that that tool is available. And that is the way to get out of this pandemic. We can't keep ignoring and minimizing, it's a certain percentage, and people make up these numbers, it's 99.999% you recover. Well, do the math. It's not 99.99%. And 500,000 people with one illness in a year, that doesn't happen. We lost 3,000 people at 9/11, and the whole world got into an uproar. We lost 500,000 Americans to a disease that we can prevent. So we need to work together as a community to stop this and slow this down. Global deaths, 2.47 million. So again, 1/5 of the deaths have occurred in the United States, just one country out of 190 plus countries across the globe. So those are things that we need to pay attention to and not minimize the facts.
Thank you.
Yes, sir. Trends, of course, we're on a downward trend, so I'm very happy and glad to see that we're getting down to somewhat of a level where we might find some relief. But as you can see on the right-hand side, the death charts are still continuing to climb. So now the deaths are mounting in relationship to the peak that we saw almost 4 or 5 weeks ago, That peak week was in January, early January, but trending up to that was almost 3 months of just sustained disease activity in our community, and now we're seeing those sustained deaths rise. So it will come down, but again, there's a price to pay. All our indicators are pointing down. There's a minor change in the positivity rate. It's starting to trend up a little, but I'm willing to sort of overlook that because last week was unusual for testing. A lot of places did not have testing open, so those numbers are only relying on a percentage of total people who were severely ill, got tested, results came back. So we can, not worry about that too much for this week, and we'll just observe the trend, over the next couple of weeks. But overall, all other indicators are pointing down, so that gives me comfort that we're heading in the right direction. So again, what should we do? We should wear our masks, stay away from each other more than 6 feet, especially in large gatherings, and then, wash our hands throughout the day, and when you're eligible, get vaccinated. So quick update on the vaccines. So there's a federal community vaccination center coming to Tarrant County this week. I believe there's a soft launch starting on Wednesday, and the full launch is on Friday. The goal of that is to get 3,000 per day vaccines given at that location, and I believe they're going to start at Globe Life Park and eventually move over to the AT&T Stadium. It was more calendar availability on both, but they're close together. And so it's going to be an 8-week effort, but they're using Pfizer vaccine. So for the first 3 weeks, they're going to have first doses of Pfizer vaccine, and then the next 3 weeks, they're going to have the second doses for that Pfizer vaccine. And then the final 2 weeks are more for catch-up, just in case some people got missed that were still qualified or missed their appointment and so forth. The goal of this site is to focus on equity. That's what the federal government has said, that we want to make sure that the underserved communities and the highly vulnerable communities are addressed first. And I'll share some planning on what we've done. But with good news came bad news. And I know our Commissioners Court advocated really hard, our judge advocated really hard, but DSHS has slashed our first dose allocations to 0 for the next 3 weeks, or at least that's what they told us. And so we have had several calls with them. This week is going to remain at 0 for first dose allocations. But after the advocacy from our leadership, they did ask our partners to come and help us. So we're getting about 5,800 or so doses from THR, and I believe we're going to get about 1,100 doses from JPS. So all in, we'll get about 7,000 doses back for first doses. But as a county, we've taken a reduction from DSHS allotment. And their argument was that if the federal government is bringing 21,000 doses a week, that will lead to an over-allocation. So they wanted to redistribute across other counties across the state. We don't agree with that, obviously, but that's what's happening. I believe on week 12, they're going to come back with a revised plan. So we're hoping to see what they come up with. Your Honor, you had a comment on that?
I would just say that we have reiterated to both, is it Dr. Garcia?
No, Imelda Garcia.
Imelda Garcia, as well as Dr. Hellerstadt, that from the very beginning when we first started talking about the FEMA clinic, they had indicated that these were extra vaccines that were coming to the state. It was not in any way, shape, or form going to affect the state's allocation of vaccines. And then we reiterated and really kept pressing on the fact that we did not expect the state's allocation to our county to change as a result of this. There was no indication given otherwise until week 11's allocation came out. We began hearing rumors earlier in the week, and so we talked with a number of people in an effort to try to make sure that didn't happen. It did. We lost, as Vinnie indicated, we have 3 hubs. The Arlington hub and the public health hub were both zeroed out. That reduced 16,000 first shots. THR went up a little bit, and they subsequently transferred 5,800 to us, but it was from the very beginning, it was the understanding that our state weekly allocation would not be lowered. So Dr. Hellerstadt has indicated that he's going to look at that for weeks 12 and 13. In addition, the state overall received in excess of 100,000 additional vaccines in week 11 than what they received in week 10. So we really feel like that we deserve to get those vaccines certainly in 12 and 13, and if they can make that up in 11, that would be great also. Because of the weather, it did not hurt us as badly as it could have. We still get the second shots in, but we've talked with the delegation. We've had letters and conversations with many of the folks. They have then turned around and we've talked with folks at the governor's office, with Imelda Garcia, with Dr. Hellerstadt, and we're just going to have to wait and see what happens in week 12 and what happens in week 13. If we do not get those restored, then our crews are going to go down. I mean, as far as we'll have to either curtail or possibly stop, because of the second shots, we'll still probably be able to keep all of our sites open. But we had expected, again, to be having UNT help us to significantly increase the sites that we could offer in anticipation that more vaccines would be coming each week. So that's going to be hurt. The other thing that FEMA did is they wanted a particular focus. We've reached out and done some manipulation of the data that we have to try to focus on the criteria that FEMA was wanting us to focus on. Once we pull those forward in the data registration process, they agreed to let us then fill the remainder of the what will be 63,000 vaccines with folks age 75 and above. In the meantime, we will still attempt to try to find and to reach into those hard to reach areas, those unregistered areas, but we've only got 3 weeks to be giving the first shots. That doesn't give UNT much of time to be able to do that. 1 week that we were hoping to do some stuff was last week, and obviously the weather didn't help us in that regard. But at least FEMA has agreed that once we've reached those, and we use census codes, once we've hit those census codes and got those folks in, then we're going to target 75 and above. Again, the inconvenient part of that is that now instead of being able to go out to the various hubs, Resource Connection, Bob Boland, Hearst, and Arlington, the Arlington people are going to be all right, but everybody else is going to now have to drive to Arlington to get those vaccines, as opposed to being able to get it here within this area.
But transportation is available.
That's the logical fallacy, Judge. Benny pointed out that one of the reasons for setting up this mega site in Arlington is to increase equity. Well, you can't increase equity by creating an access problem. Arlington is a wonderful community. It's the second largest city in Tarrant County. It's the sports and entertainment capital of North Texas. But if you don't have a car, you can't get there. So putting a mega center at AT&T or
Globe Life Park.
Globe Life Field doesn't help folks who don't have transportation to get there.
And let me just say, because there's confusion, I know there was announced this morning that they're going to start off at Globe Life Field, and they're going to do Globe Life Field for the first 4 weeks, and then they're going to do AT&T Stadium for the last 2 weeks, and then for the subsequent 2 weeks of cleanup.
Correct, yes.
The last part of my rant was going to be that FEMA needs to leave the outreach to vulnerable populations to local communities who know those vulnerable populations and know where they are and know how to reach them.
So Commissioner, there's two things. One, there is a transportation option available. Kirsten Camerano has more details, but I believe with the agreements that we got approved through Commissioner's Court last week with Trinity Metro, there's 5 or 6 different options, including some in Arlington, the VIA and the Handy Tran and all those. So there are transportation
Unless
options.
there's going to be a passing of the baton from Trinity Metro to VIA, there's still a gap in the system.
Yes, sir. And I do have other things that may address your concerns. So let's try to get through the slides, and you'll have opportunity to weigh in on those as well. So just to kind of get you, let me do 2 things. One, catch you up on what happened last week. With the weather, of course, we had to cancel our clinics pretty much throughout the week. But we started back up on Friday and ran Friday, Saturday, and Sunday. So there were questions coming, are we caught up? Yes, we're caught up on everybody who needed second doses, minus people who don't show. I think we invited probably 10,600 people, almost 10,200 people showed up out of those who were due their second doses. And the 400 or so that did not show, that happens, and we allow them to come and catch up on other days. So they will be fine. And we also did some first shots. So just the public health sites, the 3 sites that we run, did almost 14,000 shots in the 3 days, and I think Arlington did another 5,000, 6,000. So we got almost like 19,000 shots done in 3 days. So the entire week's effort was caught up, no problems there. This following week, of course, we had a lot of things to contend with. We were not going to get vaccine. We're going to get vaccine. Shipments are in delay. A lot of different things are happening. So we've had to revise our schedule a couple of times, but we will be giving first and second doses all this week. And the schedule looks a little whack-a-mole type. Certain days, certain clinics are open, and certain days, certain are not. But Monday, we ran 2 sites at the Resource Connection at the Bob Bolin facility. Today, we're going to run 2 sites. One is at Resource Connection at the Northeast site in Hearst. Wednesday, we will have 3 sites running, Resource Connection, Bob Bolin, and Northeast Tarrant County site at Hearst. Thursday, 2 locations again. Again, you know, we're having to just kind of balance out how many people are due, how much vaccine is available. So it would be Resource and Northeast Tarrant County. Friday, we're going to do Resource and Northeast Tarrant County and do a soft launch for our drive-through at Farrington Field at the Billingsley Fieldhouse parking lot. And then on Saturday, we will have the Hearst site running and the drive-through running at the Farrington Field. And also on Saturday, Baylor Scott and White and TCU collaborative drive-through will come alive at the M&G Carter Stadium parking lot. So there's a lot of vaccination activity still going to be happening this week. And again, we're trying to balance availability of vaccine, when the shipments are arriving, all of that. So some of this is going to have to be just in response to how those pan out. But the goal is to get all the people that are due second doses done and get all our first vaccine out, because all that was getting transferred to us would be first doses. And we're, at least on the plan, we have it all given out. Now,
and I guess the other thing that I want to stress
Yes,
is please understand that in no way, shape, or form are any of these locations anywhere near the maximum amount of vaccines
no, they're not.
that they could be distributing had we received more vaccines.
Correct.
We can get up to the point to where if we were doing this on a daily basis, that we could probably be giving somewhere between 40 and 45,000 vaccines a day.
For the week, Your Honor.
For the week?
Yes, sir. And then when you add the drive-throughs, it goes up to 60. So current weeks and invites are going to be about 25,000. So we're at about less than half capacity for this week. So if we were to get ample vaccine, we can literally more than double these numbers and we'll still be okay, because we have enough room in our current system. And that doesn't count the Baylor Scott & White new drive-through that's coming open, doesn't count all the other hospital partners like THR and JPS and others that are working in the community. Those numbers are separate. And we have ample capacity. So Now let's talk about a transition to an equitable approach. Just like Commissioner Brooks mentioned, there's been a lot of talk about making sure that equity is top of mind. There's been a lot of push from the National Academy of Medicine to follow an equitable framework for vaccine allocation. And also the national strategy from White House is making a big push. You're seeing the results of that at the FEMA-run site in Arlington. Their recommendation is to start using the CDC Social Vulnerability Index. That has been there for quite a long time. CDC looks at several different criteria. We've talked about this about 3 or 4 weeks ago. But social conditions can impact your health because it can impact your ability to access health care. Just your ability to avail of that opportunity can be impacted by a variety of factors. And there's 16 different things, whether your income level, what kind of household you live in. Is it multi-generational? You've got a big family, you've got a young family, a lot of those things. Are you senior? What kind of minority status do you have? Do you have language issues? Or if you have housing and transportation concerns where you may not have appropriate housing or appropriate transportation. All of these social factors, they're social determinants of health that can impact your ability to even seek the opportunity that is available to everybody. Right? So now how do you fix that? You raise the equity for these folks. You give them a little bit extra help so they can reach up to that opportunity. So that's what the Social Vulnerability Index is all about. It puts people on a scale from 0 to 1. So 0.76 and above are the most vulnerable. And CDC already had identified what are the most vulnerable communities in Tarrant County. So this is broken up by 4 different categories. Socioeconomic status, household composition, language, race, ethnicity, housing, and transportation. And this next map is a little bit of an amalgamation of all of that. And I know it's very cluttered, so I have a cleaner map for you next. But it shows where is Tarrant County the most vulnerable. The deeper blue colors are where it's the most vulnerable, and we've kind of decluttered that. So here's a more cleaner map, and we've outlined the census tracts that correspond to those areas that are 0.76 or above, the highest vulnerability census tracts. So now our database is coded. What we found is that there were about 20,000 people that had registered that were under those high SVI census tracts. 6,000 of them had already been invited to get a vaccine. So that remains, almost 14,000 remain. So that includes a couple of thousand out-of-county people as well from all across the Metroplex. So that's not a whole lot. And looking at what has been happening with the vaccine and where the signups are happening, we already know that these are the areas that are falling behind on getting signed up also. And as the judge mentioned, that effort is going to continue over the next several weeks to continue to sign these folks up. Commissioner Allen has started a couple of efforts of her own trying to get people signed up. We've talked to a variety of community organizations who are looking to do the same. Some of the referrals from churches that Commissioner Brooks gave, they've reached out directly. They're trying to sign people up at churches. So it's slowly but surely starting to happen in our community. Working with UNT, we will be laying out a plan with them on how to focus in on these communities so we can get the sign up improved. It may not be in good time for the federal site, but we will have people signed up and we'll have the ability to address them even later. So that's where the most vulnerable live, and that's where the highest prioritization is going to be. So who should we prioritize? And then, like the judge mentioned, if there's not enough in that pot, who could we go to next? We know that people over 75 are highly vulnerable. They're getting the most severe form of the illness. They're the ones who are dying with the illness. So it makes logical sense to include that group. When we looked at our database last week, total we had about 83,000 people or so that were signed up that are 75 years or older. We had invited about 30,000 of them already for the vaccine, so that left about 53,000. So when you combine that 53,000 and the 14,000 or so from the SVI group, that gets you to about 70-ish thousand number. And we're looking to do 63,000 at the federal sites. So it should take care of all of that need right off the bat. But that is not the only thing. I think public health, from our prioritization standpoint, we also need to switch to this kind of an allocation model. So we're seeking your guidance. If you're okay with it, we would like to expand, we would like to move away from the priority zip codes that we did a few weeks ago and go to this model. But let me explain. We're not saying that this is the only group that's going to get vaccine. They're going to get a portion of our effort. My suggestion would be we spend half the effort on these priority groups and then the rest of the half on the other groups. Now, in 3 weeks, if this group is exhausted, automatically all of that effort is going to move over to the rest of the groups. But again, this is just a guidance seeking from you all, because ultimately you decide on what we need to do. But we want to make sure that this is presented to you. We feel this is very equitable. It's vetted out by a lot of national entities, this model. A lot of other places are starting to move in this direction, and I think it would be high time for us to consider this as well.
In theory, this is an equitable model,
Yes, sir.
but nothing's equitable if you don't have the vaccine.
That is true. that is the big conundrum. But at least we will have set up the model that actually gets us there. And the vaccine, even though in limited supply, we already know we're in underserved communities. So just look at it. We have the resource connection and the Bob Boland location. Even the northeast site, you may not think, but there's a lot of inequity around that area, a lot of socially vulnerable census tracts. Similarly, we've been doing some mobile outreach with our partners with MedStar. They're taking information from us and going to underserved communities. I think they stopped at the Las Vegas Trail 1 week, Como Center another week, Stop 6 another week. So we're starting to do some of these things so that we can address those equity gaps. So I believe this is...
JPS has
Yes.
allocated their vaccines to clinics in those vulnerable.
Absolutely. And even THR, when they take data from us, they ask us to oversample in certain zip codes that are based on their own community health needs assessment. And they end up overlapping with these areas. So it's working in our community. I just wanted to make sure you all are aware that this is the model that we're moving to. And again, this is not only effort is going to be spent in these areas, because I think that's where the issue was when Dallas originally announced and DSH said that you can't do that. We're not going to be able to exclude the rest of the group. We're going to spend a certain percentage of our effort to prioritize some folks, and then rest will be open to everybody else.
Vinny, I'm a little nervous about going 50%, and I'd like to hear some of the thoughts from the court, because again, I know just how frustrated. Now, we are targeting the older, and most of the calls that I get are from the older populations, and they're just very scared. And so I want to be very sensitive to that. But I hate to see us put 50% versus 25% when we're, I was thinking more along the lines of 25, when we are seeing still the scarcity of vaccines. But that's just a feeling, and I don't know where the rest of the court is in that particular regard.
So let me clarify one thing.
We get a tremendous amount of calls.
Yes, sir.
When we just named 10 zip codes, my phone rang quite a bit.
Yes, sir. Ours did too. So let me clarify one thing. The formula is if there's not enough folks in that group, it auto allocates the rest of the capacity to the next group. So even though I may say that 50% is going to one group, it's not really the case, because it's going to bump it over if there's not enough people there. But we're not hung up on 50%. We're okay, whatever direction y'all
One
go.
other question, Commissioner Vickers, before. Teachers. So many states have said that teachers are in that 1B category. Why? Is this the federal government or is it the state government? Why can't we get teachers put in as a priority?
Yes. So there was a federal allocation up to the plan. So 1A, federal matches up with our 1A pretty evenly. Federal 1B was critical workers. So that included government workers, police officers, teachers. They had 16 sectors, defense sector, even like folks that are grocery store, or retail workers, restaurant workers. They were all considered critical infrastructure. And then 1C was where people 65 and older and people with underlying conditions were. Texas jumped over that federal 1B and went to federal 1C. So that created a lot of demand for vaccine, but not enough vaccine available.
So you mean 1B is not included at all?
So 1B, for the federal 1B is not included. So what we've done is taken any people that are in those critical infrastructure that are Texas 1B qualified, and we've been vaccinating them. So we've vaccinated a lot of teachers, we've vaccinated a lot of police officers, defense sector, variety of other groups that fall under those 16 federal sectors because they were qualified under R1B. We haven't been able to do young, healthy 25-year-old teacher because that is not available to us as an option. Even with our prioritization, the basis of all of that would be 1A and 1B because that's an overarching, even all the social vulnerability index stuff, all the 75 years old, all of that is after they're shifted into 1A and 1B. So that's kind of the overarching, state
So I'm
directive.
confused. I want to be sure I understand this. We refer right now to 1A and 1B.
Yes, sir.
Well, what you're telling me is that federal 1B
Is
includes
different.
all teachers.
It includes 16 sectors, including education.
Well, but
Yes, sir.
teachers are one of them. That's
Yes, sir.
education.
That is correct.
So why then, and then you're saying that in Texas, we keep referring in Texas to 1A and 1B, but you're telling me we're at 1A and 1C,
Correct.
and we don't have 1B in our category.
That is correct. Yes, sir. We don't have federal 1B authorized to us in Texas. We went from federal 1A to federal 1C.
So who else is in 1B why haven't we been hearing, who else is in 1B?
So in federal 1B, it's all the critical infrastructure folks.
So
16
how are
sectors.
we getting them in Texas?
We're including them if they have either age over 65 or underlying health conditions, which half of the population has. So we've been doing those folks. So government workers, for example, if they have underlying health conditions, which a lot of them do, or age over 65, which a lot of them do, they're qualified. But if they're young and healthy, they're not. Similarly with teachers or other school staff. Those that fall under, and underlying conditions can be a lot of things, right? I mean, you can have blood pressure. People don't know that sometimes. You can have diabetes, obesity, variety of things. So people do qualify when they fill out our form. Our system automatically looks that there's an underlying health condition. So a lot of people have qualified. We've done thousands of school workers
So
already.
why do we keep referring in Texas to 1A and 1B when we're not doing 1B?
Because Texas labeled our 1B. It's a Texas 1B. So in our system, it's labeled as Texas 1B.
Because we do things different in Texas.
But on
Danny, most of the calls-
on the local level, we have taken the position basically that it's better to ask for forgiveness than permission.
We haven't,
We have gone ahead and included some of those federal 1B people in our vaccination program without asking the state.
Well, and they were qualified under Texas 1B. So we just wanted to create an understanding because I was getting a lot of calls like you were. I want teachers done. I want defense sector done. I want so-and-so done. Okay, well, let's look at where they are in those critical categories and are they qualified under Texas 1B? A lot of them are. So we took them, right? And we've got that going. Yes, sir.
Benny, the biggest problem I'm hearing, and I'm hearing from a lot of people who are, pretty much everybody that I'm hearing from is over 65, and they've got underlying issues, but they're over 65. Their biggest complaint, number one, is almost all of them signed up the end of December, the first 2 weeks of January, and other than an email at that time, they've not heard a word. We haven't done an adequate job, in my opinion, of communicating with these people. They're begging to know what is going on, because they call the numbers, they get on hold, and they never hear from anybody. Okay, so they call our office, or they send us an email, and then we play this silly game, and we try to find out some information for them. And then, but we're doing one or two or three a day when, if we had some kind of system that would be able to tell these people, and I understand if you don't have the vaccine, you can't put it in their arms. But I am hearing that over and over and over again that I just don't hear anything.
Understood. So, Commissioner, a couple of things I wanted to clarify. So that 1A and 1B bucket that we have, 1A is caught up to almost current date. That's been our goal because that's the highest, priority group. Those are healthcare workers, first responders, people that have daily exposure to COVID due to their job. So those are current. But because of that prioritization, a lot of vaccine did go to that group as well. So then in the 1B, we've got internally separated 1B critical workers. So those would be your teachers and other 16 sectors, and general 1B, which is the public. So the 1B critical, I believe, is currently on 7th of January. That's the date we're working on. And 1B general, I think we're finishing 5th of January and started on 6th of January. There's not been enough vaccine to make a big dent, but we started registering people around the 22nd, 23rd of December. We've gone through about 2 weeks, and I think we've done a couple 100,000 people. Because some days were big. Each day had like 44,000 people signed up. So we've gone through all of those. So yes, there's a lag time right now, but it's because there's not been enough vaccine. As far as communication goes, we have sent them emails. We've sent them automated text messages and phone calls. We've put out a ability to check their status online. Our call center thing is going live with the company tomorrow. They should have the ability to look people up. But the answer is going to be, well, I see you in the system and we're working on this date. That is not a prediction on when you will get your vaccine because there's a lot of unknowns. If we didn't know that we were going to get zeroed out on vaccine, we don't know if we're setting up more sites. There's a lot of things, some days we decide, hey, we need another site, so we come up with it. It increases our capacity to get vaccine out. So there's a lot of unknown variables to give an accurate calculation. We started off with a 3 to 4 week estimate. Currently, things are looking like you're probably going to be waiting 4 to 6 weeks from the time of sign up, but that's sort of a big statement, right? If you're in 1A, you could sign up yesterday. I mean, I can tell you, yesterday we were allocating appointments. People had signed up at 5:30 p.m. yesterday, and at 7 p.m. we had issued them an appointment for day after tomorrow. But they were in 1A category. So it depends on which category you fall under and how much vaccine is available at that time. But it is being distributed according to that formula that is agreed upon and approved. And, we're working really fast trying to get everybody vaccinated.
Well, I want you to know that everybody that lives in Precinct 3, because you haven't included any of them in your census area, okay? We're not all rich. I've got a ton of retirees who worked hard all their life at places like Bell Helicopter and GM and Lockheed and all those places that, just shivered in the cold because they didn't have any electricity. And now they still can't get the shots and they can't get an answer on their shots.
Yes, sir. I understand. And again, this is not about being rich or poor. It's 16 different factors. So to give you an example, I have 3 young kids. My family would be considered socially vulnerable, right? Because having young kids puts you at a risk for a lot of other things. The ability to access opportunity, kind of slows down because you got young kids to deal with. So there's a lot of factors that this thing covers. But a lot of the common ones are poverty, transportation issues, age, race, ethnicity, all those type of things. So there's 16 factors, not just rich or poor.
How difficult is it to send something out to everybody still in the database to let them know that they're still on the list and that we're working to get to them as quickly as possible?
We can send that out, yes, sir.
Well,
It would have to be a phone call.
Let's do it.
Okay, we can do that, yes, sir.
Because I too hear all the time, and the other thing I hear is I'm 85, I got 2 people across the street that are 40 and look to be in great health condition, and I'm still waiting to get my appointment, and they've already gotten their second shot.
So one thing I will tell you, once we do that, people just show up at a vaccine site because they say, oh, I got called for my appointment, because they don't really wait to see what that message says. They just hear this is an important message from Tarrant County Public Health and they jump and go. But we will send a generic message through a phone call and a text message that, yes, you're registered on our database and we're working as fast as we can to get you an appointment. And we will do that to all our database. The people that are not yet vaccinated and are waiting in queue, we can do that. Yes, sir.
So Vinny, along with that, could you let us know what that message is going to look like and what it's going to say? Because what's going to happen after that, are people are going to call.
You have dealt with the after effects, I know.
So it makes it a lot easier if we say, okay, this is what public health just did. This
Yes.
is what this message looks like.
Yes.
Yeah, my office is back and hear them yelling back there right now. What in the heck are you doing?
Yes, sir. Okay.
Okay, so Vinny, I'm fine with this prioritization as you presented. I mean, I know obviously that there's still many factors that are beyond our control, but if this is the most equitable way at this current time that we can distribute the vaccine, then I'm 100% for it.
Thank you. And again, you know, this is not a line in the sand that we can't come back and revise. Let's just try it this way. And, you know, if we need to come back and revise, we will. This is not something, we've learned throughout the COVID pandemic. We got to keep our processes fluid and respond accordingly. As the situation changes, more vaccine becomes available. Maybe we don't need to prioritize. Everybody gets
y'all are
vaccine.
50? 50?
I still question whether that's the right number. I mean, I would probably prefer something a little more. 35.
Can we hear you yet? Can you hear me?
So let's go
I'm
ahead.
concerned about if we make adjustments to this 50%, especially as it pertains to the population over 75, I would say that's probably 50% of the constituents from precinct 2 that I hear from with concerns is based off of being, you know, having that age. Really, it's probably 70 and up that we're hearing a lot from.
Well, no, but overall, I thought that we only have about 10 or 15% of all the people registered that are over 75.
Yeah.
83,000,
So-
30,000 have been invited, so that leaves 53,000 of 75 plus.
So that's less than 10%.
So there's, I think there's, I got to
And
look
they're
at the
gonna-
registration.
excuse me,
Yes.
And they're gonna get included in the 25, in the FEMA already, they're gonna be 100%
Yes.
above. So what I'm saying is to further take what we're getting on our other, for the few vaccines that we have left, to allocate them also 50%, we're gonna take the people below 75 almost down to nothing.
Okay.
But excess capacity would roll over. So I wanted to be very clear. So let's say I have 500 vaccines. I'm saying give 250 to this group and 250 to that group. But if in this group there's only 10 people, the rest of that moves over to the other group.
I understand that, Vinny, but they're already getting all of the FEMA,
Understood.
which is 3,000 a day or 21,000 a week. They're already, I mean, that's the second criteria. Everybody we're gonna be calling for FEMA is gonna be over 75. So they're gonna get 100% of that. And now we're gonna take what's the reduced number that we've got, and we're gonna reduce it even more for those people that are below 75.
I hear what you're saying, but I'm also hearing and not seeing these numbers on paper. So it feels like air math to me, which y'all know I don't like. So either if we're gonna get into the percentages of things, then I would like to see some numbers. And then I would need to make a choice based off of who I'm hearing from and what I know to be equitable. Obviously, it would be anecdotal based off of what public health is suggesting based off of their understanding of the data. So.
And it's easy to focus on populations over 75 years old. The most important demographic up there, to me, is populations living in high social vulnerability index areas. These areas have been disproportionately affected from the standpoint of both infections and deaths.
Okay, will you go to that chart, please, Vinny, where you show the factors? Age is one of them, but there are others. So I'm not saying just to
This one?
isolate those. Yeah.
Yes.
So I mean, that includes the people that you're talking about. I don't really know what we're doing here.
Okay, here's the air math.
Okay,
We're basically gonna give out, you have 6,000 vaccines this week, about that you're getting from THR and from JPS.
Yes, sir, new doses.
And if what you're saying is correct, then 50% would go to 75 plus, 50% would go to those under 75. So 3 and 3. The 21,000 that's coming from FEMA is all going to 75 plus. So out of a total of 27,000 vaccines, 24,000 are going to go to 75 plus, and 3,000 are going to go to less than 75. So that's that's slightly more than, or about 89% that are going to go to 75 plus, not 50, 75 plus, and about 3,000 of the 27,000 are going to go to people under 75.
okay, so what are you suggesting then?
I'm suggesting that this be more like a 25-75, and that would mean that this would be 4,500. No, this would be 1,500, and this would be 45. So we're still going to end up with this being 22,000, and this would be about 4,500. So it's still an insignificant number, but it's still 1,500 more than what it was.
Okay, Vinny, can you support that?
Yes, we
Okay,
can
so-
live with that, and we're okay with it.
What are we talking about here?
Well,
We're okay
if
with
we had a
25%
Coke, we were going to
allocation.
be given
Yes.
50.
Yes,
So what you're suggesting is,
A 25-75 split of the
and Vinny, you
vaccines
can
that
support
we
Yes,
that,
can.
absolutely.
and that's still equitable.
that is still equitable,
Okay.
because the number of people in the total database signed up are below that number. It will over-allocate them, it will prioritize them, so it will be fine.
Perfect.
Yes.
Not perfect. My remarks were in English. We're not just talking about people over 75, and we continue to
Well,
just
it includes the
No,
SBI
but-
folks.
on
Yes, sir.
people
My
over
point
75.
was, that's one of the factors of the SBI is age 65 or older, which I wasn't saying that's
One
all
of the
who are.
factors.
Right, one of 16 factors.
Yes.
So my comment about the 75 plus was just saying, here's who I've heard from.
Correct.
So I definitely want to make sure that that's a consideration, which in fact it is.
It is, yes, ma'am.
That's it.
So are we all good with 25% allocation to the new, because I want to go away from the priority zip codes, and I want to start focusing on the SBI groups and people over 75. We've heard from DSHS a couple of weeks ago, address those communities, and we've heard from a variety of different entities that are starting to do that. So if y'all are okay, we'll try it out. If y'all get different feedback, we'll come back and revise it.
Okay.
So
Okay.
I'm going to repeat myself. I am for the most equitable solution that we can put in place at this time.
Yes, ma'am.
Okay.
Works.
This may be the most equitable compromise we can put into place, but it's not the most equitable solution.
I said what I said.
I would agree with that.
I said what I said.
Go forward.
All right. So, and then just to kind of catch you up on what's been happening all across with vaccines. So this is our dashboard. We've had to change the update day on this because originally the schedule was Monday to Monday, but I think we're going to do Wednesday to Wednesday. We were finding that DSHS data was not showing up on Mondays as promised. It would come sometimes on Tuesdays. So we've shifted the date to Wednesday to allow for that. So this is data from last Wednesday. 291,000 people across, or 291,000 doses delivered across Tarrant County already, and this is week 9. And then out of that, 274,000, almost 94% were Tarrant County residents. 6%, or almost 17,000 people were out-of-county residents. Out of which, as you see, almost 10%, or 205,000, are have at least one dose given to them. So almost 10% of the county has received one dose. 85,000 people have received their complete series of 2 doses. That's 4% of the county. The charts on the right, I would bring your attention more to the zip code chart, which is on the left-hand side. you can see high vulnerability areas already starting to pop up. Middle part of Fort Worth, East Arlington, those areas are lighter shades, and it correlates to how people have signed up. This is the next chart. So the next chart shows that people are not signing up as fast in those areas compared to other parts of the county. And if I can go back real quick, you can see the similarities, right? If people are not able to sign up, they're not able to get vaccinated. So again, the point is, we've identified prioritization for people that are signed up. That still leaves us an issue of getting the word out and getting people signed up in these vulnerable communities. And that's the point that the judge was trying to address earlier, that it doesn't leave us enough time to do this for the federal community vaccination sites. But we will continue to build upon that effort, and then with the prioritization plan that we have now, we will address those new signups. They're not going to be very big, we know, but it will give them an opportunity faster. When they sign up, they will be able to get vaccinated faster. So as of last Wednesday, there were 609,000 people. I think now the current numbers are almost 625,000. And then there are about 410,000 Tarrant County residents and almost 200,000 out-of-county residents that are signed up with us, and about 483,000 altogether. Almost 80% of those signed up are currently eligible. So that's in our database, but overall, we know that we've given out at least a couple 100,000 doses, so a lot of this work is already being done. So there's a lot of effort that has already been in. I want to make sure people understand that there's a lot that has happened. 10% of the county has at least received one dose, and we're just 10 weeks into it. Yes, could it have gone faster? If we had the vaccine, it would have gone a lot faster. But given the limited number of doses, there's a lot of effort that has been done, and we're doing okay on that regard. Here's the breakdown by race, ethnicity, and age group, and I wanted to point out that this is people that have been vaccinated. So 17% of the vaccine has gone to people over 75. I know the judge wanted, last time we talked, to look at some of that information. And almost 26% has gone to people between 65 and 74. So I know, Commissioner Paficus, you do hear complaints from 65 or 70 years old, but a lot of vaccine has already gone to that group. If you combine the two, you're looking at almost 40% of the vaccine having gone to people 65 and older.
But that was the 1B group.
It is the 1B group.
You would expect that.
Yes, sir, we do. And, and the
You're
younger.
set up for them.
Yes, correct. But I just want to point out that, people do complain because it's a big group and they're feeling left behind, and their neighbors got it or a friend got it, but almost 40% of the vaccine has gone to that group. And the younger groups that are getting it, either they have underlying health conditions or they were healthcare workers, mortuary workers, first responders, all of those groups that were getting done because of their prioritization of 1A. Race ethnicity data is improving, but when the numbers get big, every percentage point is hard to move. But we are up to a little bit over 6% on the African American group. I think we're up to 4% on the Asian Pacific Islander. And there's an other category that has started to show up now since DSHS required data entry. There is an other group, so that could be anybody, but that's a big percentage of the vaccine that's gone to these folks. And then similarly in the Hispanic and Latino group, there's been some, I guess, improvement, but it's still at 6%. That is a far cry from almost 30% of the county being Hispanic or Latino. So a lot of work needs to be done in all of these areas, but I think there's improvements in those numbers. I didn't have room to put the sign-up charts, but we're seeing improvements in the sign-ups also. So the efforts are working. It's just we need to find ways to keep improving on that so we can get the right amount of folks signed up so they can be vaccinated. All right, that's all I have. Happy to answer any other questions. All right.
So Benny, I do have a final question. I'm hesitant to ask for an estimation, but just trying to get a better sense of, for those who need their second dose, kind of what's that remaining number?
So currently, altogether, almost 22,000 people that need their second dose, I believe. We have almost 16,000 people do this week, and then the following week 3,800, the week after 3,600, and that catches us up to what we've done so far.
Okay. Thank you.
Any other questions for Vinnie? Okay.
Thank you.
We have some audience participations, but those are primarily also pertaining to the declaration as well as to the my mask mandate order. So do we want to take those up at this time and then?
Yes.
So the first thing that we'll look at is the item 2, the approval of the 6th amended declaration of local disaster due to public health emergency and renewal of same.
Sorry, Your Honor, I did not realize you were going to take that up. I'll get up there and help you with this. Point of clarification, Your Honor, do you want them to simply come up and talk about any agenda item, or do we want to go through the items and then ask them to speak?
Well, the people who have indicated they want to speak are all, there's 3 people. And every one of them are either mask mandate and or disaster declarations. And then there's one that's also energy failure, so we may let her go ahead and speak about that at the same time. And I think I'll just call them up, and then after that, we can just proceed through the deal.
Very good, Your Honor.
So we're going to start off with Robert Bucher.
You have reached the phone number for Robert Trevor Bucher. I'm unavailable to take your
The following 2 persons are here, I believe, present. First is Joseph Jenkins. Please come forward, sir. If you would go ahead and state your name, and you have 3 minutes then in which to make your comments.
Yes, sir. Thank you, Judge Whitley. My name is Joseph Jenkins. I'm a retired veterinarian. I've never been before the Commissioner's Court before, and never felt the need to come. I practiced veterinary medicine in Tarrant County for 40 years. I consider myself a scientist. Veterinary medicine requires a knowledge and practical use of epidemiology and immunology every day. I'm not here to tell you that COVID-19 is not a disease and doesn't require any protocol to keep you from getting it, but I am here to argue the science. We've heard follow the science from the beginning, and I think we should do that, especially now, because maybe the science is a little different than what people want to hear or want us to believe. Back in December, President-elect Biden told us that the darkest days are before us. That was on December 22nd. A member of his administration reiterated it yesterday, and although it wasn't true when I heard you were going to consider extending the declaration today, I went to the website for the agenda, and under discussion, possible action concerning activities associated with the impact of coronavirus on Tarrant County citizens, businesses, and governmental operations, it said there on the agenda there was no new information at this time. I was glad to see that you did have a lot of good information given to you to consider, and that vaccinations are playing a big part. I think the county has been doing a good job. I'm sorry to hear that the federal government is messing that up, and I agree with Commissioner Brooks completely that it's a lot better job done here locally than with them messing with it, but nothing any of us can do anything about. But, you know, all the trends since the end of December, both locally and nationwide, show that COVID-19 is on the decrease, and this is long before the effects of vaccination could be felt. Number of cases, hospital beds occupied with COVID patients, and ICU beds occupied with COVID patients have all steadily decreased. Now the effects of vaccination will start to kick in, and that will be decreased even more. I have some articles that I have a copy for each of you if you want them.
If you'll give them to Mr. Manius, he'll pass them out.
I'm happy to distribute from the, one of them is an opinion piece, but it's written by Johns Hopkins epidemiologist from the Wall Street Journal. It's a very scientific opinion piece where he lists the fact that he thinks by April 1st we'll be in herd immunity. And I think maybe extending the declaration for 3 months may be premature, and I would urge you maybe to extend it for 30 days and reconsider at that time and give the citizens of Tarrant County suffering from mental, physical, and financial hardship a break. I don't think that the declaration is listed on the website. It may not be the correct one since the agenda items weren't correct, but you know, it's not the one being enforced at this time, and I don't know if it's the correct one or not, and so to extend it I don't think would be appropriate, but I urge you to maybe reconsider the time frame and extend it as necessary. Thank you for listening to me.
Thank you, Dr. Jenkins. I will say that the emergency declaration on any given day can be revoked and suspended at that point in time. And we've been doing our normal course has been the 90 days. And so that's why you see the 90 days in the declaration that we have proposed. Next is okay, I'll try them in just a minute. Next is Tracy Jenkins.
Hi, greetings to the court. I'm just a normal citizen, mom, and excuse my attire, I teach bar and I had class right before I came here today. I, like the veterinarian, am here to voice an overlooked and different perspective from the public health representative. I also think that masks, ending the mask mandate sooner rather than later is what I'm hoping to have happen. I feel like history has proven that masks end individuality and expression, making people submissive. It's an ancient tool to break people down psychologically, and I'm just hoping that you will consider all the adverse effects of mask wearing, in particular from addiction to bankruptcies to suicides, what the effects that it's having on children. Just we are a society that is or has been the land of the free and the home of the brave. And I feel like in the name of crisis after crisis, our freedoms are being stripped, the Constitution is being ignored. You know, we've gone through typhus, cholera, smallpox, Spanish flu, and never have we ever forced healthy people to mask up and force these kind of restrictions on people. I've always felt like if you want to wear a mask and you feel like it's going to keep you safe, wear it. But forcing it on anyone is unconstitutional, and it has been extremely harmful. I've got 3 children in school who are miserable every day, all day. So my request would be, please consider lifting the mask mandate. And I just want to point out that we were told initially that it was going to be, you know, not from you guys, but from higher ups in the federal government and Fauci and so-called experts who said it was going to be a 2-week thing. Then it was going to be lifted once we got the vaccine. Now they're saying possibly 2022. So my request would be, please do not move the goalpost anymore. We're losing trust in governing officials over this.
Ms. Jenkins, the one comment I'll make is that the mask order we're talking about, my mask order as currently is in position, is on businesses and asking businesses to require that customers that come into their facilities must wear masks. The individual mask mandate is one that has been issued by the governor. And the governor's mask mandate is still in place. So there's just a little distinguishment between what we're talking about here today and the mandate for an individual to wear a mask. And that mandate is from the governor.
So the one, you're talking about lifting it just on businesses, but if the governor is mandating it, isn't that in conflict?
And in conflict, the governor always supersedes the counties. So what I'm talking about and what I'm going to propose, or what I'm going to order if they extend the declaration, is that the mask mandate, that when somebody goes into a business, that the business require folks to wear the masks while they're in their businesses. The mandate, the individual mandate, is a mandate from the governor. So when you leave that business, then the mandate for you as an individual to wear the mask is a governor's. When you come into this building, the county has said you will wear a mask. So that's the, basically that's adhering to the order that I have had in place and will extend again given the extension of the disaster declaration. But once you leave our building, the mandate for you to continue to wear the mask is the governor's mandate. And that's a mandate that's been in place since shortly after the business mandate was put in place.
So if you remove the mask mandate for businesses, would we still be required to wear masks based on the governor's mandate?
Yes.
So it's just a,
His supersedes mine in all cases.
okay. Okay, well, all I can say is choosing to focus on extreme safety over freedom is not an American value, and it's not one that I can agree to.
Thank you.
Thank you.
I've got let me do this, and you need to fill out a form, and that form was supposed to have been filled out by 10 o'clock, but I'm going to venture into that area where I probably shouldn't venture into and just say, go ahead and get a form, fill it out, and I'll let you ask your question.
Hello.
Robert, this is Judge Whitley. You asked to speak. It's that time on the agenda. You have 3 minutes.
Yes, sir. Okay, per the 418 code that this is built around, it does state the mayor, the county judge, or whoever the head designee over the disaster declaration can at any point stop, suspend, modify, or ratify the mandate. That goes from the governor's mandate on down. That's very, very specifically put out there. Most people do not even know the vaccine is not FDA approved. It is only approved through emergency order. It's not FDA approved. This is from the Mayo Clinic, who is heavily involved in the vaccine production. I bet Benny forgot to tell the public that. Look it up on mayoclinic.org. How many deaths from this vaccine, mask, and business mandate is it going to take to end these illegal edicts? What will it take? Will it take 70% of people getting the vaccine? Nope. That won't work. What will it take? Will it take extending the mask mandate to May the 25th? These masks are not working a year, and you can't blame it on the people. You got to blame it on the CDC, the Fauci's, all the liars, all the heads up there. It's time for y'all to start being leaders. Start being leading and start following. You're just no different from Pharisees, holding tight to your positions. That's how I know that this is starting to reach you, because you're holding on to the very thing that you have, which is just your position. Mayor Price is figuring this out. The reason why she is stepping down, because she figured out it's time for me to stop. It's time for me to back up, because I know it's not going to get me anywhere. There's only a variable in science, and the variable in science is the masks aren't working. That's the variable. If it was working, we would have been done a long time ago, like the 2-week curve said. But no, according to CDC, the CDC website, Because, I mean, I guess Vinny gets to get away from lying. They said 99.9%. This is on the CDC website. But we don't want to talk about that either. You're not doing this for the people, you're doing it for y'all. And the lack of leadership skills shown through both disaster declarations, looking at the roads. I was in Arlington at a hotel and had to go through Main Street, Arlington, and Four-Wheel Low because of lack of treating on the roads. And no, nobody's heard from Mayor Jacobs. No wonder where he's at. The people are still waiting for each one of y'all to actually stand up and follow your bios, which you haven't done. And instead, you're going to keep following a dictator named Abbott, who has been caught in Dallas 3 weeks ago with small business owners, no mask on. Keep following him, though. If you want to question whether I helped or not during the snowstorm, I was there. I just asked the Rail Club, who opened their doors up to keep people warm. So the Arlington mayor stayed quiet through all this, and the commissioners and the county judge too. Where were y'all at in this? Put your money where your mouth is, or are you just going to sit down and keep being quiet? As I stated in previous commissioners' court, you hyper-focused on the vaccine and you left people to die. 135 people died on the road, and that's at the hand of y'all, because y'all had 10 days. 10 days.
Time's
when y'all
up.
refused to treat the roads.
Thank you. Lana Austin.
I just want to say I am super grateful for all of you that have chosen to give your heart and your time to do all of these things, because I think we all are here for that very reason. But I do think there are two sides to every story. And I've only heard kind of one side today of the gentleman that just shared all the statistics with the graphs and the bars. And I'd like to know, is there the ability for us to do that and show something very different than what I think he's presenting, with the numbers, with the death toll, with what's counted, with what happened to influenza and the flu and all these other things, because I think that we're making decisions based on misinformation. And I want to hear both sides and make an educated decision instead of being fed one side. Our world has gone crazy, and the propaganda that we're being fed is terrifying. And so I want to know, as a citizen sitting here, standing up for myself and my children and all that God has given us, that we do not lose the ability to look at both sides, but to be given the little bit that we've given, with this man having that much time. The gentleman on the phone just had 3 minutes. I don't know what the whole thing was because I was filling out a form, but I want to see all of those things, because I think that is the right and just thing to do. That's my only question. When do we get both sides so that we can all make a decision, instead of y'all are all making decisions and saying and doing things that we're kind of sitting here going, I don't know the protocol, but this all seems cattywampus. And it makes me want to decide, I'm going to ask the Lord, is this something I need to do? Because I have a voice and I want to be heard. And I appreciate you taking me and letting me come and speak when you shouldn't have done it. I bless you in Jesus' name, and all of you to make wise decisions and be guided by him. Y'all are precious.
Thank you, Ms. Austin. The presentations, what we have said as a court is the public can come and make 3-minute comments as it pertains to a particular issue on the agenda. Thank you, ma'am.
I think my bigger question is, he gave his side. Is there a place where I can come with a group of people to have as long as he has to share a very, very, very different opinion? Because that is not what I side with. I think it's slanted. I think it's skewed. I think it's misinformation. And I, as a citizen, am tired of being misinformed. So it's not towards you. It is towards the system. Y'all are lovely people. Nobody is giving their day or their time to come here to not be heard. But I want to be heard, and I want my side with somebody like him. I'm going to go home and work on a PowerPoint. I'm going to get all my kids to work with me to show me how to give you some different information so that we can make better decisions. Because I love all of you people, and God loves y'all. And for God's sake, I don't live in China.
I don't live in Russia. I live in the United States of America, and I plan to stay firm here for my children and my grandchildren and my great-grandchildren to be able to do what God's called them to do. And it is not to be run by propaganda or tyranny, and not to have both sides to make an educated decision. In Jesus' name, that's what I want to know. Please tell me what to do so I can have longer than 3 minutes and to combat what he's saying in a beautiful way.
Ms. Austin?
He has his side. I have a completely different thing that I'm reading. And you may not agree with it, and it's fine. I just want you to hear it.
We have our staff, they make the presentations to us. You have 3 minutes. That's not as long, I grant you that, but that's the policy that we've established it as a court. And that's the way we've approached things. We don't, he comes and he makes his presentation. As court members, we all look at different things. We don't, while we don't talk about it here, we each have our own opportunities to examine and to seek and hear advice of people who come and talk and meet with us. But we're not going to get into presentations back and forth. We've got our staff and our folks who we're going to rely to bring stuff to us. And we're not going to debate it. You have your 3 minutes. And that's the way we've set it up as a court to do this. And and other court members may agree individually to meet. I have met with a number of folks, and I'm willing to do that, but we've established a method by which we go through our court proceedings, and that's the way we will, at this point in time, continue to do that.
Clarifying that, I didn't know. I truly appreciate your gesture, and anybody that would like to meet with me, I would love to meet with any of you lovely people, all of you, anytime, one-on-one with a group of people. There is another side, and I think you're slanted. So thank you so much. Bless you.
Thank you. Mr. Mangus?
Okay, thank you, Your Honor. Members of the court, we're now going to the administrator section.
Well, okay, you're going to do these items right now? The declarations?
What we're going to do is we're going to give you a very brief presentation on item number 1, and then we're going to go into we're not going to seek any type of court action on item number 1. It's just a briefing, which will take less than 5 minutes, and then we'll go ahead and seek action on items 2, 3, 4, and 5.
Okay.
So Ms. South is going to address the court at this time as it relates to item number 1.
Lonnie, can you go ahead and move it, please? Thank you.
Raise your mic.
Good morning. Is that better? So I'll be very brief this morning. I know GK mentioned because of the weather last week, we don't have our usual full report, but we will pick back up next Tuesday with a complete report. We did want to go ahead and give you a quick update on the status of the call center since it's scheduled to go live on Wednesday. Again, because of the weather, the training was delayed for a couple of days. However, Public Health and Group O completed training today. So Public Health completed their training yesterday, and Group O is completing their training today with their agents. So again, Go Live is scheduled to happen tomorrow at 7 a.m. The initial 25 call agents will be available, and we will transfer one of the 2 lines from the public health vaccine lines will go over to Group O. So there will still be 1 line remaining with public health. Public health has access to a dashboard to see how the calls are being handled, and as long as everything is running smoothly, then the second line is planned to transfer over 7 days after the initial go live date. And that will also be, the 25 agents will also be onboarded on March the 9th. Are there any questions on that before I go past?
Well, if I remember correctly, this vendor has operations in the state, but then also out of the state. So were they affected by the storm in such a way that it's going to change any of this?
I don't think so,
Okay.
no. And again, the vaccine line will assist individuals with vaccine-related questions, registration, and appointment lookup. If someone does call the vaccine line and they have a question related to, contact tracing or testing or just a general public health question, Group O will transfer them back to the appropriate public health line. And I do have Kathy Andler here with Public Health, if y'all have any other detailed questions to ask of her, or I'll be happy to try to answer any additional questions.
About the call center?
Yes, ma'am.
Okay. I'm curious, so if someone calls in and they are given the option to select which language that they want to communicate in, then are they on the onset given the option to select like one for English, two for Spanish, three for Vietnamese or whatever? How does that work? And then how would someone know to ask, to ask for a particular speaker in that language?
I'm gonna let Kathy answer.
Okay.
Good morning.
Morning.
Good morning. So when they do call in, if we do have a dedicated Spanish-speaking line, but if they are calling in one of those other lines, then at that moment the agent will contact Language Line. That Language Line is available with the call center Group O as well as with TCPH, and that's how we've been able to assist other languages.
Okay. Will you repeat that last part? Sorry.
Language Line, I'm sorry, there's a vendor Language Line, so not only Group O uses Language Line, but TCPH does as well.
Okay, so you're both using the same translation service?
Correct.
Okay.
Correct.
Okay, gotcha. Okay, thank you.
Thank you.
Any other questions? Thank you all.
So members of the court, if we can now go to item A2, we're requesting that the Commissioners Court approve the continuation of the first amended declaration of local disaster issued by the county judge on March 18, 2020, in its entirety until May 25th, 2021. This is a 90-day extension. This is the sixth issuance of this extension. And just a quick point that if at any time that the Commissioners Court wants to end this declaration, it simply has to take a vote of the court. It doesn't have to stay in effect till 90 days, but our standard has been to maintain these extensions for 90 days.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson? Motion passes unanimously.
Members of the court, we can go to item number 3. We're requesting that the Commissioners Court simply receive and file the executive order of Judge Woodley as it relates to which he has issued on February 23rd today.
Move to receive and file.
Second.
We have a motion and a second to receive and file. Any discussion? Please vote. Commissioner Johnson? That was a yes.
Okay, I'm going
Motion passes unanimously.
to move to item number 5 before we get into the discussion of the unprecedented winter storm that we dealt with. So on item number 5, we're requesting that the Commissioners Court receive and file the declaration of disaster which was issued by Judge Woodley on February 15th concerning the winter storm that impacted the county, which began February 12th, 2021, and then approve an extension of that order for a period of 30 days.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson? Motion passes unanimously.
So members of the court, if we can go to item 4 fairly quickly. I think that there's been a lot said about what our staff, your staff, has done over this last week. I do want to reiterate that the work of the precincts, not only on the sanding of the roads and keeping our roads clear, but also to provide water for some of our facilities so they can be maintained. Facilities department spent a lot of time around the clock, bringing our facilities up and keeping them up. And so we have included in your red folder a document that looks like this. It is a spreadsheet that I've asked Mike Amador, who is the acting director of facilities, to put together, that gives you a snapshot as to where we are and what we still need to do. And with that, I'm going to ask Mike to come up and simply go through this very quickly. If you have any questions or if you need some additional time to look at it, I know that that this is pretty short notice that you received this, but we were working even as of yesterday to bring some of our sites back up, and we wanted to give you the most up-to-date report that we could. So would you like for us to go through this, or would you like us to simply let you review it and then we come back next week and talk about it in greater detail? I think that by next week we'll be able to give you a more clear update as to where our facilities, what's the status of our facilities, and hopefully we'll be fully back online. As of yesterday, there was just one facility that was still down somewhat, and it came back online this morning. And once again, Mike, you and your team, you did a fantastic job, along with the Sheriff's Department, all of our law enforcement people. County Auditor's Office was involved in all of this, and so just want you to know that there was a large group working on this.
Thank you very much, and please convey to your folks how much we appreciate all the hard work that they did over the last.
And so, members of the court, also mentioned the Auditor's Office. Auditor's Office handles payroll. We worked last week and through the weekend, and so that all the correct reporting was made available to employees, and I think that Renee, you and your team have been answering a lot of questions. I know our team has also, and so once again, we thank you for that also.
GK, I do want to add, definitely my thanks. Spent a lot of time on the phone with Mike about my garage facility in Kennedale that had water leaks and things like that. I don't see that on this list. So, I mean, everything is now resolved, but I wasn't sure, was this list just supposed to show outstanding things or also things that had already been completed?
They should have, it should have shown all the issues that we addressed. I will tell you, we're putting this thing. Yeah, that's why it may be better we wait until next week to have a discussion.
Sure. Very good. Thank you.
Thank you. Your Honor, we don't have any questions on that. We're not seeking any action by the court as it relates to that particular item.
Okay.
That's all from the administrators.
Facilities, come on back up.
Very quick, while he's making his way, GK, is this discussion, this action item, this is going to remain as a reoccurring agenda item, will it?
On item number 4, yes, until we clear all of our buildings. The reason that we did a 30-day extension on that is because all the cities are still trying to determine just exactly all the damage that they had. You can imagine the water pipes and things like this.
Yeah.
And so this allows us to continue to seek reimbursement for not only government, but private citizens also from FEMA and SBA.
Right. Very good. Thank you.
Good morning. Morning, Your Honor, members of the court. We have one item for your consideration. We are requesting approval of change order number 1 to the Infinity Contractors contract for the cooling tower replacement project at the Terry County Correction Center in the amount of $92,669.
Move for approval.
Second. We have a motion and a second. Any discussion? Please vote. Commissioner Johnson? Motion passes unanimously. Thanks, Mike.
Thank you, Mike.
Ms. Glenn?
Move to receive and file personnel agenda.
Second.
We have a motion and a second. Receive and file personnel agenda. Please vote. Commissioner Johnson? Motion passes unanimously.
Good morning.
Good morning.
We have 2 additional items for the court. The second item, we're asking the court to approve an out-of-class pay extension for the county administrator's office. Mr. Manius is requesting the extension of out-of-class pay for Ms. McMillan, who assumed the duties of the Assistant County Administrator in December of last year. If granted, this extension will take us through the end of May. It is important to note that the cost of this extension will be fully offset by salary savings.
Move for approval.
Second.
Motion is second. Any discussion? Please vote. Commissioner Johnson? Motion passes unanimously.
And our last item, we're asking the court to approve a waiver of terminal benefits for the sheriff's office. The sheriff is requesting a waiver of 240 vacation hours. We actually started at 400, so this is down to 240 hours effective February the 27th, the details of which are outlined in your communique. We are looking at a net cost to the general fund of right at $4,000, and that does include fringe benefits.
Move for approval.
Second.
We have a motion is second. Any discussion? Please vote. Commissioner Johnson? Motion passes unanimously.
Thank you.
Good morning. Have you heard from that old Razorback?
Once or twice. We have 4 items for your consideration. The first item is an award recommendation for RFP number 2020-180. It's for agenda management and board appointment solution for information technology, awarding to Prime Government Solutions in the amount of $584,004.94. If approved, we're also requesting contract approval.
Move approval.
Second.
We have a motion is second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Oh,
We heard something.
we heard from him even though it was muted. That was a long, you must have yelled pretty loud there. Motion passes unanimously.
The second item is an award recommendation for RFP number 2021-001 for meeting management and video streaming solution for information technology, awarding to Prime Government Solutions in the amount of $212,365.43. If approved, we're also requesting contract approval.
Move for approval.
Second.
We have a motion is second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Getting better and better. Motion passes unanimously.
The third item is an award recommendation for bid number 2021-023, Tim Curry Criminal Justice Center Security Improvements for Facilities Management, awarding to CMP Commercial Construction in the amount of $502,431,000. If approved, we're also requesting contract approval and acceptance of the payment and performance bond.
Move for approval.
Second.
Second for an amount of $502,431.
Sorry.
There's quite a bit of distance between the two bids you had. Did that cause you any concern that there was a $218,000 difference?
Mike, don't linger.
Commissioner, they did a scope review with both of the contractors, and the second one, the one being presented today, seemed to be the most complete. This is for security improvements. For obvious reasons, I won't get into too much detail, but the contractor being proposed seemed to have everything in their scope of work that is required to complete the work we need.
I guess my concern would be like they had almost twice the number on the material cost. That's pretty significant.
I agree, Commissioner.
What would have typically been a specification type items that, you do, this is what we want, and to have that variation on, I could understand that on labor and markup and different things, but generally on material costs, when you have a specification.
I can't answer to that, Commissioner, but we can certainly go back and get you answers
Well,
to make sure we understood what the material costs were.
Comfortable that you're getting what you think you're getting, because there's a big gap here between the two bids.
Agreed.
It's like 40%.
Agreed. So, we could, if you'd like, we can go back and we will get you that answer, Commissioner, and make sure that we didn't miss something. I know that they vetted the companies, and therefore that's why the second company is being recommended here. But we can certainly go back and verify everything.
Well, I would particularly look at that particular one issue.
Okay.
And,
We'll do it.
So, and the overall amount.
Absolutely.
So the alternate, also alternate number one was 150. I don't know whether I don't think you're using alternate number one, are you? Maybe you are.
No, we're not. We didn't accept alternate.
Yeah. So, but if you did, I mean, there's a huge $200,000 difference there. So something isn't sounding right.
So would you prefer to hold this for a week and let's bring it back to you?
I would support that.
Okay, then we're gonna
Do I need to remove my motion, or?
just, let's just,
I'll withdraw my second.
okay.
The last item is an award recommendation regarding bid number 2021-041, annual contract for medical supplies for public health, awarding to the various primary, secondary, and alternate vendors listed in the court communique per unit price and discount for items not listed.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Commissioner Johnson, you have an interlocal agreement. I'm going to ask the attorney, have y'all reviewed it?
We have this.
Move approval.
Was that a yes?
Yes, he said he had reviewed it.
Move approval of item 8N1, A and B.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Are there any appointments? Okay, you have before you the claims, including the addendum.
Move approval of the claims, including the addendum.
Second.
We have a motion and a second to approve the claims, including the addendum. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Briefing items, I believe, Russell, you look impatient. Like you're ready to head to Austin.
Good afternoon, Judge, Commissioners. Thank you for having me today. And yes, Judge, it's afternoon by 3 minutes. So a couple items to work through with you today to talk through. First off, this week is a very, very busy week in Austin. We have Senate Finance Committees ongoing. The House Appropriations Committee has begun their process ongoing through HB1, the appropriations bill. But also on Thursday, the two House committees over jurisdiction, who have jurisdiction over the PUC, which has jurisdiction over ERCOT, is having a joint hearing that's Senate State Affairs, House State Affairs and House Natural Resources Committee. Chair Craig Goldman, who is a Tarrant County representative, chairs the Natural Resources Committee and is very, very engaged in this process. The Senate Business and Commerce Committee, chaired by Tarrant County Senator Kelly Hancock, will also be having a hearing on Thursday to deal with this particular issue of oversight, disaster preparedness, and trying to figure out how to handle and move forward with the various issues that the governor laid out in subsequent emergency orders that he issued over the last week. So we'll be dealing with that and working with those offices. The message regarding those individuals that do have very, very large bills, electricity bills, is that they are going to be working through the process and seeing what is legislatively available, what the PUC and ERCOT can also do as well. So that we'll hopefully see over the next few weeks to a month, options come out legislatively on how to correct those issues and get some relief to those individuals across the state. And I know that our office received a bunch of calls as well as other county offices did regarding what do we do with those issues. And the messaging is that we need to kind of pause, the governor pause the bills going out or anyone losing power based on non-payment, and figure out, let the legislature do its work and figure out a solution that'll make those Texans, give those Texans some relief. I wanted to discuss that with you all. Also, we're looking at a delegation letter regarding weeks 12 and 13 on vaccination allocation. Senator Nelson is spearheading an effort to do a Tarrant County delegation letter to dishes regarding, again, weeks 12 and 13, which they were reduced again to 0, but trying to get that bump back up. And so her office and a number of other offices have been instrumental as we work forward on this particular issue. And then finally, a little bit of timeline regarding the American Rescue Plan Act of 2021. This is the Biden administration's $1.9 trillion COVID-19 mitigation or stimulus act. It came out of the Budget Committee, House Budget Committee yesterday after a markup. It'll go to House Rules Committee in the next day or two, and it should be on the floor of the House by Friday or Saturday of this week, just depending on how scheduling does. It takes a couple days, it'll get kicked over to the Senate, and then they'll work through their processes. It is going to have to go through what's called the bird bath, which is a process through reconciliation on whether or not an item qualifies as a taxing and spending issue, and that's referred to as the bird bath. So you're going to hear a lot of that term. For the next few days, I believe the report from the Senate parliamentarian is due out tomorrow on what qualifications in the bill currently do and do not meet those standards. So just as an FYI, we're going to hear a lot of that over the next few weeks. Hopefully they will have something passed into the president's desk by March 15th or middle March. So we'll keep you up to date as we know more, and as those texts, those bills do come through. We're expecting some amendments in the House Rules Committee in the next couple of days, but we'll be watching all that and get you all information as it comes available. And with that, are there any questions?
I have a question going back to your first topic with the state and the moratorium on the utility disconnection. Has there been conversation also about collection and credit reporting efforts?
I haven't heard anything regarding credit reporting, but I can check and get back with you on that. I can reach out to some folks. Thank you, Commissioner.
Any other questions of Russell? Thanks, Russell.
All right. Thank you very much.
That's all we have at this time, Your Honor.
Okay, with that, we will recess our open meeting, proceed to close to discuss items exempt under section 551.07, 1072, 074, 076, and 087. Megan or Lonnie, are you on? Yep, thank you. Having returned from our closed session, there being no business to conduct at this time, we stand adjourned, and please remember in memory of the 3 items that we talked about earlier.
Yes.